hormones and replacement therapy. Carol graduated from the University of Wisconsin School of Pharmacy and is certified nutritional practitioner, being a wealth of expertise for innovative work optimizing your health through compounding techniques. She's a true leader in the field, having founded and chaired the compounding special interest group with the American Pharmacists Association. And Carol also serves on the medical advisory board for the Center for Menstrual Cycle and Ovulation Research, and showcasing her commitment to advancing health solutions. On top of all that, she co-hosts the popular radio show Take Charge of Your Health, and we're here she's here today to share her knowledge with a wide audience. And we're also thrilled to welcome Corinne Furnari, a certified clinical nutritionist and licensed physician assistant with over 30 years of experience in integrative medicine. Corinne graduated with honors from USC here in California, physician assistant program, and has since built an impressive career developing specialized protocols for bioidentical hormones and age management, which we all love. Her unique skills also include certification in office medical aesthetics procedures and orthopedic procedures. Reflecting her diverse expertise, Carol and Corinne co-host Take Charge of Your Health, an amazing program empowering listeners with cutting-edge insights into wellness. Thank you for joining us today. Hey, Corinne and Carol.
Thank you.
Today?
Thank you for having us. We're really looking forward to this.
My pleasure.
You were on our show last 2 weeks, and our audience came alive. Listening to you, they were so excited with the information that you shared. Mostly we focused on peptides. And so this is going to be new and quite interesting and essential.
So today I'm excited because I wanted to make it also more exciting for everybody that's listening today. And I think we all are interested in longevity and anti-aging, as we met through A4M, and that's the American Academy of Anti-Aging. We're all members there, and that's our passion. I think that's in common. So I'm very interested today to learn a little bit about your passions related to anti-aging, and I would love to start by talking about how do you feel about the nutritional effects of nutrition, how it affects our genetics and DNA kind of expression. So I wanted to start the topics on that. So who would like to take this?
Well, you've opened a big chapter.
Exactly.
Epigenetics. Let's give people some examples of how can they turn on or turn off their epigenetics through nutrition.
Well, I just had a client who came aboard, and she said, I have the BRCA gene mutation. She said, what should I be doing? And so I said, basically, you've got to make sure that your body's working properly. And so I talked about the various hormone systems and lipids, how well you make cholesterol, but intertwining with all those hormones, every hormone has a cofactor and coenzyme. Every metabolic process in your body has those two things, and cofactor is mineral and coenzyme is a vitamin. And that is crucial. If you don't have those pieces connected to those activities that your body's running, you're going to be sputtering. Your body will not work at its optimum.
And to understand also for that patient with the BRCA gene, understand that it is not determinate. And we see certain food combinations that accelerate it and make it more determinate, whereas other food combinations will suppress it. And you will be older and not even have it express itself. So there is a wonderful book, one of the best books I've ever read on this, was Dr. Christine Horner, who is a breast surgeon, who was the head of the Cancer Society in the Midwest. I don't remember what state. And her mother got breast cancer, and she did everything right, absolutely everything right, followed to the T all the standard recommendations. Her mother was cured. 5 months later, or 7 months later, I don't remember which, there she was back with an active, aggressive breast cancer. And the mother said, I don't want to fight this any longer. I don't want to go through this. And the mother died. And Dr. Horner said, well, what could I have done? And are there any other things? So she started doing research and finding books of research, peer reviewed, on preventing and curing and supporting breast cancer. And she created a whole book on it called Waking the Warrior Goddess. And then she found that there were a whole list of things. One of them, very important, was curcumin. She changed her practice. She started giving, before she would do any surgery, she would take a month where she would have people eat ground flax seeds. And she would find that the tumor would shrink minimum 10 up to 20% before the surgery. And that can be very powerful in terms of outcome, in terms of the success of the surgery. And then she wrote all these protocols using large amounts of curcumin that even if you are using traditional meds, they support. And she has studies that show that nutrition supports the chemicals that they're using and assists them to work more effectively while keeping the other cells healthy. And that's what this is all about, keeping the healthy cells optimally healthy so they can resist progression.
That is great. And that's very important when we work with our cancer patients. We want them to be at their best health. We're not oncologists. The oncologists need to do their work, but we need to make that body just very strong and healthy, immune resilient, so that it can hold them through all these toxic treatments, unfortunately, that they go through, whether it's chemotherapy or radiation. But the body has to be very strong and resilient. And their immune system, unfortunately, is like shut down at this point. And I think that's a very important point, to reduce the inflammation and give your body a chance to fight back on its own as well, which is great. Thank you for that. So I have another question. So how about we ask about, because I know you talked about it, like for epigenetics, how can methylation, and if there's any examples of things that improves our methylation in food, for example, for our viewers?
Well, we can start with the basics. Well, methylization is the ability for cells to break down, particularly B12 folate, but all of our B vitamins before they're absorbed are methylated. Methylation is a process that our whole body goes through. But specifically, when people are asking about methylization, I'm going in and out of the pronunciation, they're usually referring to B12 folic acid.
Yes.
And what it is, the ability to replicate the cell. See, we're like a fax machine. It's not we have cells and they're alive forever. We have cells, they serve a purpose, they age, they die, and then the body reproduces another exact copy. But if there are certain blocks for that reproduction, then you'll end up with incorrect cells being made, almost like your toner on your fax machine is going out. And every time you remake another page, it gets harder and harder to read. Well, when the B12 folic acid, essential for reproduction of cells, are methylated, then you get the probability is a very high exact copy. And without it, you're not going to get the same replication of cells. And we know that 45% of the people have at least one gene that blocks methylation, but then we have two genes, then we have four genes. If all four genes are blocked, then it's a big problem. If we have one gene blocked, then then we we focus on it. But then three genes, we're down to less than 70% of the reproduction that it should be. Carol?
Well, this methylation picture became more and more apparent as time went on. And this is what I discovered in piece by piece. Our liver has to detoxify everything for us. And methylation, just adding the one carbon group with its accompanying three hydrogens, is part of what the liver does, conjugate that to a molecule, and then your body can discard it. Estrogens need methylation. And then I got into the wild world of adrenaline dominance kind of things. And guess what? Here we go again. MAO and methylation is needed to help handle adrenaline. And then I looked at histamine. All of a sudden, we're talking about this mast cell activation syndrome. And I have a habit of like typing in everything, this disease, that disease, and progesterone. And to my surprise, the whole hormone cascade is in there. And progesterone can help balance your mast cells out. But then when you release the histamine, progesterone doesn't actually help with that. But guess what does? DAO enzyme and methylation again. So this is such a big piece, as Corinne just mentioned. A good percentage of the population does have some slowed or difficulty in methylation. So you can tell with genetic testing, you can have that done now. You can tell if on metabolic tests you have a high homocysteine level. This molecule is considered very irritating, very inflammatory, and you need to methylate it down to reasonable levels to not destroy your blood vessels. So there's that. And then there's creatinine, one of our measurements for kidney function. If creatinine is actually low, you've got to go and consider that your body might have some difficulties making creatine. And creatine is called a methyl sink. Why is that? It's such an important molecule to your body, and your body needs to make it, or you can find some in food, but your body has to make it. It uses up methyl groups, and then poof, your methylation for your estrogens, adrenaline, and histamine are depleted. So I also will say, if you have like overexpression of adrenaline, like you get adrenaline turned on and you can't turn it off, there's no rest for you, you're constantly anxious, irritable, that's a very good clinical sign for very poor methylation.
That is great. So to translate that in clinical, we are doing for methylation, which is very important for our anti-aging protocols. We can measure homocysteine, creatinine, and also definitely we're doing now more and more of the MTHFR testing, and these are available labs for Quest and LabCorp. Everybody can test for those. That's super cool. And then how about histones? That's another thing that maybe can work on any input on histones and epigenetics, nutritionally, how that can affect epigenetics and expression of DNA?
You got me on histones.
Exactly. I was, see, the
Your turn,
nice
Dr.
part,
Bar.
the nice part about having a radio show is you can always toss it to the next person. The
So
answer.
the methyl, we know now the methyl groups are very important for detoxing and keeping the DNA, whether it's turned on or turned off at some point. But histones are the ones that also keep the DNA kind of like bound or like entangled, so that it's not easy to read the code, or to be off at some points. So there are a lot of also cruciferous vegetables and spinach. I think you talked about spinach before, and a lot of green vegetables that helps our histones. I'm gonna say one like that, like cruciferous vegetables, especially pseudocyphane, which is one that is like this the sprouting broccoli.
Yeah,
seed,
yeah,
also with
sulforaphane.
Sulforaphane.
Yeah,
yeah.
yeah.
So there
Very
are
important.
Are
nutrition that
you re-
help us. Yes,
are
sorry.
you referring to the DNA methylation clock?
Yeah, I was okay. So that's another test. Yes. So I was thinking of things in our nutrition that we can do to help our DNA stay healthy. And since epigenetics influence our DNA, and people think their DNA is like whatever they got from their parents, and it's going to affect their whole life. But now we know that epigenetics can influence how your DNA is going to perform throughout life, and it doesn't determine your future. So I was thinking some nutritional things like you would suggest, which you did for methylation. I was thinking histones is another good one also for DNA. But now with longevity, now we can measure methylation of the DNA. And yes, please take it for the clock. That's awesome.
Well, that is something. But if you're looking for food, one of the best foods is actually eggs, because choline is a
Yes.
precursor to betaine, which
Mhm.
is trimethylglycine. So plenty of eggs for methylation. There's another little piece here that I look at, and it's what is your microbiome doing? Because it's supposed to be making those methylated B vitamins for you.
Yes.
And if you do, again, a serum test, and if you're checking folate and you're checking B12 and you're really at the bottom of the range, that translates in my mind that your microbiome needs some help, that you don't have the proper microbes to help you with that methylation process. It should be there. So it's another little piece of feed your microbiome too.
And
Another,
definitely another, sorry, go ahead.
uh, okay, another thing on methylation is they've put folate everywhere. They even spray the crops with it, and they put it in all the vegetables. It's a synthetic
Mhm.
folic acid that literally blocks our ability to absorb natural folic acid.
Mhm.
And so the end result is that we might not, if we were eating foods, might not end up with a deficiency. But because our receptors are blocked by the synthetic, then we're ending up, a very large number of us are ending up with deficiencies, which we know can be very dangerous. It can be particularly dangerous in a pregnancy, but
Mhm.
it can be particularly dangerous as we age, because without the appropriate B12 folic acid methylated, we end up with high, what they call homocysteine, another molecule which is very inflammatory. It's like this inflammatory molecule running through our veins, touching the side here, making a burn, touching the side there, bouncing back and forth. And wherever it touches, it's creating burns inside the arteries and the veins. And the end result is the body then has to create scabs to heal it. And you end up with, and then you end up with um, um, hardening of the arteries. So methylation carries through all phases, from pregnancy to newborn to cardiovascular disease, et cetera, et cetera.
And going back to betaine, don't you think beets is another good one? Has betaine, right?
Yes, it does.
So
Sure
one more
is.
thing. And that's the reason now when our patients come in with their supplements and they have their vitamins, we say like you really need to get a methylated B12, a methylated B folate, because in the past that wasn't a possibility, and still there are products out there like people still can find those in the GNC or whatever. You really want to make sure your vitamins are methylated, so active form of vitamins when you're picking up and you're reading the label, correct?
Right, right.
Definitely.
And I always recommend that you use these anyway. It's not going to hurt, probably work better for you anyway. Even if you don't have a methylation problem, there's no harm in using a methylated B complex supplement without all the testing to say, yes, you have this, or no, you don't have it. If you probably will see maybe sometimes some dramatic results. I've had clients give me that kind of feedback. They really saw a big increase in their health when they started a methylated B complex.
It's just easier to absorb.
Yes. So
Mhm.
can we move to a next topic, which I think Kira loves that, hormones? Because for anti-aging, I tell my patients there's no way we're going to do any anti-aging without balancing your hormones. So hormones are very important, especially if you want to stay in a viable environment for the cell, keeping it in a healthy state. And can we go through the cascade? We know like vitamin D is very important. It's almost a pre-hormone. Going down to your cholesterol, because everybody's blocking cholesterol, pregnenolone, just go through the cascade, progesterone, to go into the testosterone, vitamin E, because it's a huge cascade that people just don't know. Most people come in, it's like, I want testosterone or I want estrogen, and they don't know that
Exactly.
it's all put together. But
You
can we
don't.
paint the picture for everyone?
Well, let's start with cholesterol, because
Yes.
I like to look at a lipid panel, and there are people who are actually low on cholesterol. And I've seen some very disordered hormone pictures with total cholesterol like 86 to 130. I had about six clients in a row. That's how they presented. It's shocking. I think, how are you alive, right? Um,
Yes.
so cholesterol is such an important molecule. According to Thomas Lewis, who did some research on the sweet spots on various laboratory testing, he said total cholesterol should be 220 to 280 if longevity and good health is your goal. Now, you get these tests done, and you're going to have red flags all over these tests if you're actually in the best place. There was also a life insurance company who did a study. I think it was Metropolitan Life. They wanted to know at what total cholesterol levels did people live the longest. And so they did that study, and certainly they were highly motivated because they're selling life insurance, and they found it was 270 was where the best longevity is. So it makes sense. The normal range of total cholesterol used to go all the way up to 350. We have, by committee, shifted a normal human range of this particular analyte. We shifted it down in an effort to sell statin drugs.
You
We
got
did not
it.
do this to have a good, healthy life. And my heart just bleeds. If you're in conventional medicine, you are just tormented by practitioners who have these protocols they're supposed to follow within their health system, and they'll say, oh, you have to have statins, you have to have statins. And it is a disaster. As you lower your cholesterol, you cannot make your hormones. It's the mother, grandmother, or whatever of all your hormones. You can't make them, nor can you repair your cells, nor could you grow a baby, for instance. Yeah, if you were to be pregnant, your cholesterol levels go way up because you need that to make another human being. And then we turn around and we think it's evil and try to suppress it. What a load of propaganda. One of the interesting things I learned from Dr. Michael Gerber was speaking about this one day. A bunch of people were gathered. He said, "We don't worry about high cholesterol. It's low cholesterol that's scary. You can't feed enough cholesterol to get a good result. Um, you can have a couple dozen eggs a day and you're not going to be able to bring your cholesterol up very much. Your liver has to be making it." So another point to look at, how well is the liver functioning if you actually have low cholesterol without a statin, because there are some of those. So Dr. Gerber said there's a parasite. You've got parasites living off your cholesterol. So I do bring this up, and it's funny when I bring it up with somebody, they say, "Yeah, I think I have this problem." They said, "I've been thinking about it. What can I do with these parasites?" So first and foremost, there's cholesterol. Corinne, do you want to take up another hormone?
Well, we start out with cholesterol and we concentrate the cholesterol. And once the cholesterol is concentrated, we have pregnenolone.
Yes.
Now, for a long time, pregnenolone, it really had no function. But what we're finding is that a higher concentration of pregnenolone is essential for brain function. And when people are having trouble in memory or in focus, or brain fog, or even sleeping, you give them pregnenolone, and very often you get a very fast and appropriate response that's noticeable by the patient. And that is a concentrated cholesterol. So what's happening is here we're trying to get rid of all the cholesterol. And the end result is that the body concentrates the cholesterol and makes a hormone that goes to the brain to nourish the brain and allow it to function. But then pregnenolone is very interesting because not only is it supporting the brain, it's the basis for multiple hormones to be created, from cortisol to progesterone to estrogen and testosterone. They're all based out of cholesterol, 1, pregnenolone, 2.
Mhm.
Carol, you want to go?
Sure, I'll just
So if
pick up
one was
the
the mother, this is the father of all hormones.
Exactly.
here's the hormone family. So pregnenolone is very, very interesting to me, and I've been following this on metabolic testing too, because you need active vitamin A to make pregnenolone from cholesterol. And so many of our supplements have beta carotene,
Beta carotene.
not vitamin A. You need animal sources for active vitamin A, and or you need good thyroid function. Your thyroid hormones can help you convert beta carotene into vitamin A. So I consider that particular test, when you have a low pregnenolone level, I think thyroid and vitamin A immediately. And the dose range in the laboratory can go to 200, 250, and I will have people come up with numbers like 10, 17, and maybe you've seen that too. So how
Just
can you make,
measurable.
yeah, almost not measurable. So this is a critical area in that whole hormone cascade that has not been paid attention to, mainly because we don't measure it, and maybe we don't have enough information about it.
Yes, they thought it was an unnecessary, or just similar to the way they treated DHEA. DHEA is also formed out of pregnenolone. It's one of the most abundant hormones that the adrenal produces. And they felt that it was totally unnecessary. They had no real purpose for it. And now, as we're understanding it, those people they test geriatrics, speaking of longevity, and those people who have higher immune systems and higher mental acuity have higher ranges of DHEA. So DHEA is also acting in the brain and supporting the immune system. So you have these factors for DHEA. But then DHEA has a downstream also, like pregnenolone. Carol, you want to
So
go with the downstream?
yeah, well, DHEA is your most abundant hormone that's made from cholesterol. And this too often does not get measured. So many people at perimenopause, menopause, they're thinking sex hormones only and forget that I would submit menopause is really should be called adrenal pause if you have symptoms when you stop cycling, because it's the adrenal glands that have to take up the hormone functioning. No longer the ovaries, they're tapering down. And so DHEA is a precursor for both testosterone and estrogens and can fill that in. So sometimes when I see that low and I see consequently low testosterone, low estrogen, I'll say, let's just supplement the DHEA first. And let's see what happens to the downline hormones from there. Now, this is a test I like very much, because if you go and check your hormones, let's say you wanted to do a serum test after you're taking DHEA, all it's going to verify for you is absorption, gives you no clinical information. But if you take DHEA and measure estrogens and testosterone, consequently, now you have a more functional test that means something that you can look at and kind of evaluate the clinical response. So this is very much an improved test when you measure the whole cluster. So DHEA declines just down a straight line with age. Highest levels are like in your late 20s. And by the time you're 80, you have about 20% of what you used to have. I like this for clinical science. When you start losing your hair on your legs or your armpits, think low DHEA.
As a matter of fact, I've had a patient that I gave DHEA, and they were so surprised and pleased that their hair in their genital area and to some agony in their underarms and on their legs returned. They literally saw the difference. And DHEA, as Carol said, is a precursor, and it's a precursor for estrogen as well as for testosterone. So, like Carol said, she gives DHEA. If someone is low in testosterone, women, I'll start them out on DHEA. But very often when I give DHEA, I don't see in my testing the downstream. Although people feel better, I cannot document it. But in males, it's very direct. When you give DHEA, you can see it convert to testosterone very directly. And I was going to say something that I always remember. There's a doctor, Mashad Ali from New York, brilliant doctor, older now and not practicing. But he always said the worst thing that happened was that they named hormones sex hormones.
Yeah.
Because now they can deny the importance of the function of these molecule manipulators on every single cell in our body, from our brain to our muscles to our uterus, testes to our toenails. Every cell in our body are influenced and directed by information received from these hormones.
Amazing. So before DHA, we have progesterone above that stream, right? So let's talk about progesterone. I know you love it. And a lot of men don't think they need progesterone. I tested for all my men and I supplement them most of the time. They're on a small dose. And I'm going to ask you about that because, like, most of my men, I check it, and even though they think it's a female hormone, I said, you're going to get it. So,
What
Yes.
dose is a small dose?
Yes, what
I usually
doses?
start them at 5 and
Oh,
10.
really? Very small.
Yeah. And I take
Okay.
it up as we test. Yes.
Okay, so I'm going to say I would go to the area of 200 to 300 milligrams creams or capsules with men, and their levels are equal to the follicular levels in the menstrual cycle of women. Where does this hormone come from? It comes from the adrenal glands. Men make very little progesterone in the testes, but in the testes, it's actually a precursor for testosterone. But we don't see that pathway going very well in women. That kind of surprised me. When you want to treat like BPH or even prostate cancer, some of that was traumas. Some of those lower doses of progesterone may be okay if you're just aging gently. But if you're using testosterone for a man, there's an enzyme, 5-alpha reductase, that activates testosterone to dihydrotestosterone. And I fear many men have too little progesterone because that enzyme also works on progesterone. And this in men or women, if you see symptoms like acne and hair falling out kind of thing, I think you're out of balance with a lack of progesterone. Progesterone is a 5-alpha reductase inhibitor. It's an aromatase inhibitor. In men, in women, it's your natural moderator of other hormones. And unfortunately, we have given those duties to big pharma. So the drug finasteride, we use it as let's say Proscar for BPH and Propecia for male
Hair
pattern
loss.
baldness. Yes. Go to Wikipedia and look at the structure of finasteride, and then go look at the structure of progesterone. You will see that they are very close in structure. So there are huge and terrible side effects with finasteride, including loss of function, loss of sexual function, loss of sexual
It could
desire.
be reversible too. Sometimes, like it could be
Yes.
irreversible. Yeah.
Young men have become suicidal and killed themselves with using the Propecia. So why are we using this foreign molecule when progesterone is the wonderful thing? And it's so weird because doctors are trained to use finasteride. If you suggest to switch to progesterone, they're going, no, I can't use that.
Oh,
Like it's it's like got 3 X's for poison, wherein you're actually using the poison. It's a heartbreaking kind of situation. I asked a few men about sexual function or sexual desire because there's a theory out there, because testosterone and progesterone are very closely related molecularly too. So they say you put in too much progesterone, you're going to suppress your testosterone activity. And actually, I found the opposite is, and this is just feedback, the opposite is true. Men's sexual function and desire improves with progesterone rather than declines. I'd love to hear your feedback on that.
well, I'll give it short. I'll give two statements. One, I had a patient who had prostate cancer. And what I did, well, he was taking traditional therapies, but what I did was I gave him a high dose progesterone cream and put drops of iodine in it and had him rub it on his perineum every night before bed. And the doctor says he's never seen such a positive response. And that was 5 years ago. And he expected the cancer to come back, but we're beyond that point now. But he stopped using it, and I'm recommending that he start up again. So we cover ourselves. And then I'm going to tell a joke. There, there's a man, he drives up into a disabled parking, and they tried to give him a ticket, and he said, "But I have erectile dysfunction. Doesn't that count?" Yeah, we have to lighten it up.
So do tell, please. You said you mix it with iodine. Can you explain to people why are you mixing it with iodine?
The exact physiology, no, but one thing that Dr. Teitelbaum, Jacob Teitelbaum, was a very, I worked around him a lot and went to his lectures, and he was on our radio show a lot. He said the first thing that you do whenever there is a cancer, he said, is you get your iodine. And I like Lugol's. It's pure, and you apply it to the area, so it assists. Iodine it shrinks, it draws, it drains, and it's an antibacterial, antifungal, antiviral, and a very
anti-parasite. Anti-parasite.
And anti-parasitic. So when you're dealing with an unknown, such as a tumor, it's not everything, all everything. But when we're dealing with holistic therapies, you compound them. And it's never one thing. It's how they all fit together to support the health of the person.
So I'm just going to share what I do usually for men. As we talked about the importance of the cascade of all the hormones and one leads to the other. When I start them, I start them on a combination of pregnenolone, like a 10, milligram, like low dose. They get pregnenolone, they get the DHA at 25 if it's men, starting dose, and progesterone maybe 5 or 10, and then measure and see how they are. So that's like my initial combination for men to prep them to get their testosterone precursors in place before we give them testosterone if they're young. So what are your feedback on that? You think it's a good idea? I usually get good results.
It is a good idea. I would just say don't be afraid to go up, particularly on pregnenolone and progesterone, as I mentioned earlier. Pregnenolone, we did say it was a direct precursor of cortisol. And here's another whole group of people that you can see. You can do laboratory. You can do 4 points throughout the day with saliva or urine and see if you're having the normal production of cortisol. And this is one of your adrenal hormones. It's anti-inflammatory. It makes you resilient so you're not reactive to your environment. If you are having a lot of aches and pains, joints and muscles hurt, and if you have super fatigue, you may have all those, the cortisol, the cortisone, and other metabolites all pretty much flatlining. And one of the things I've been using in more generous amounts, and I got this from Dr. Bill Clearfield, is to use pregnenolone because it's just one step away. It goes also directly to cortisol. So when that area of adrenal hormones needs filling in, I think pregnenolone is actually ideal. And I'm going to tell you what dose he recommends. You'll be surprised. 400 milligrams.
Oh, 400. I was thinking of 100. Like if I go up, I usually go to 100 and I measure. I'm just very conservative. But the other thing, so on the other side of the sex hormone cascades, you have like the cortisol steal. That's like what we age. We start the cortisol. So can you kind of comment on that cortisol steal and why it happens and we gray and we get older?
Well, that's also called the pregnenolone steal because the pregnenolone's going right to cortisol to try to fill that in. And consequently, the other hormones that pregnenolone is supposed to be making progesterone and DHEA can be compromised.
Mhm.
So as you're trying to fill in the corticosteroids, you should be mindful that you do need these other hormones too. Sometimes people ask me if I tell them to use a bunch of things together, just like you did with your protocol for progesterone, pregnenolone, and DHEA. They say, oh, shouldn't I do one thing at a time?
So I
And
know the results.
yes, and I go, well, go ahead, but you're not going to get the results that you will putting it together, because there's interplay
Yes.
throughout your body with all kinds of systems. And when I give people recommendations, it's for particular reasons. Back to the nutrition, I put in the nutritional things like magnesium, or iodine is a huge player here too. The biochemistry for the iodine is, one of it could be that it enhances metabolism of estradiol and estrone to estriol that needs iodine.
Yes.
So you can, in the case of prostate issues, have too much estrogen stimulation, and you need that estrogen metabolized correctly. So iodine deficiency could very well be there.
Especially with age, another hormone that we do not like, but it starts, kind of accumulating more, is the estrone is like the one that kind of like, they say it's the reason why people start having cancer, whether it's women or men. If it's like, I think prostate cancer is almost breast cancer in a different form or shape, because it's extra estrogen. And a lot of people don't know that, because they supplement with high doses of testosterone, not aware that they're going to just produce a huge amount of estrogen, and they're not methylating, they're not detoxing, they don't have iodine, and all this is going to go down to do estrone.
Exactly.
And then they'll have prostate hyperplasia, prostate cancer, and it's almost like breast cancer, like in men it should be a concern. But any comments on that?
Well, I'm commenting on something you said before in terms of giving testosterone, and how you're quite cautious in giving testosterone. And that caution is appropriate. It's very appropriate, because what happens is, if testosterone is given too young, you can suppress the testes and suppress their ability to ever again make sperm. So the appropriateness and the caution has such an appropriateness to it, and a caution for the patient. It really is. It's essential. And I wanted to learn from you, because there are all those peptide testosterone precursors that I love. Precursors, because they allow the body to make what the body would be making optimally. The body can't overdose on precursors. It'll just stop making it. And that's why I find it so exciting that I'm seeing many young men with very low testosterone levels and not feeling their best. Arthritis, backache, fatigue, and 110 testosterone levels. When I was training, the low was 450, and if it went under 450, we were look for a reason, a pathology or something we've missed, and it went up to 1200. Now the testosterone levels are 800. 900 is abnormally high, and it goes down to, what is it, 200?
Yeah, 250 or something, 275.
250.
Don't cover them. Yeah. And say like you're not deficient, unfortunately. And that's what I love, the peptides. So we can talk about that, because like most young men should not be on testosterone. Unfortunately, it's available even in the gym. Sometimes a friend would give it, even it's controlled substance. It's sad. But I do get those young men that are on 200 milligrams a day. And I tell them, do you know how much you make a day if you need it? Like, I had a patient who was on 200 a day. That was crazy. And it was given to him by some doctor, cream. And he came in with cancer, prostate cancer.
What would the body make normally in a day?
So the body in males in peak performance at their young age
Mhm.
makes about 6 milligrams a day. Multiply that by 7 if you're going to give him a weekly supply. And it's throughout the day. It's not like boom, you're taking a shot, it's going into your muscle and you're just loading
Yeah.
yourself with 100 or 200 milligrams. So that's the unfortunate part. And then I love to do the peptides for that very reason, because our body is very smart and we have the checks and controls and negative feedbacks, and the body will not produce extra. Even with growth hormone peptides, I love them than the growth hormone itself because they're really safe. So
Mhm.
we need to use the gonadorelin, which is like your hypothalamus telling your pituitary, please release your FSH and LH to go down to the testis and say, let's do some testosterone for men. And it will not suppress the spermatogenesis or, any of the other functions of like shrinking of the testis
Shrink,
and that, like,
big
yeah.
problem.
So cosmetically looks odd, but if you do not want to do the gonadorelin, you can go a step further down, like remember HCG, now they're making it commercial, it's a step down further. So that's not going to affect your spermatogenesis, it will affect only testosterone release. It's only on one side, right? So same thing if you use kisspeptin, it will work that way too. So if you want to do gonadorelin, you're going to maintain fertility as well, like Clomid, right? If they want to do a
Mhm.
chemical, they can do Clomid or Clomiphene. But if you want to do a peptide, it's just amazing because you will not have that scary situation where you're giving testosterone and suppressing your chance of making testosterone ever again.
Hmm. And you said we can talk about peptides, but when we're talking about anti-aging, if we're just looking at foods or just looking at exercise or just looking at peptides,
Mhm.
it's like looking at an elephant with a blindfold on. You feel the leg and you think it's a tree, and you feel the trunk and you think it's a snake. And
Yeah.
what happens is, and in the beginning, when I first started working with hormones, women would come in and say, I want hormones.
Mhm.
I was on the Upper West Side. If I don't know if you know what that, well, no, I think
Hormones and
Newport,
Botox? Does it come with
the,
Botox?
Yeah.
exactly. I think Newport Beach is a much more relaxed, but it'd be sort of like
No,
a
plastic.
very tense area. And so they'd say, I want hormones. And I'd say, well, how are your bowels? So let's talk about your bowels. And
Yeah.
that's an important factor because that's how, through the bowels, through regular bowels, is how the hormones are broken down and released. So you don't have an accumulation. And they say, I'm not here for that. I'm here for hormones. And they really didn't understand the symphony of the body. And when you're working with the body, it really can be quite lovely. And now with these peptides, I'm so excited. But I was going to say something very quickly, and I'll pass it back. Michael Smith from England?
Oh yeah,
He
I think
was, yes. I used to work with peptides
yeah.
20 plus years ago through Michael Smith out of London, out of
Mhm.
England, and they would get sent to this country. They were very high quality, but they were not as sophisticated as they are now. I imagine he is, but now more so. But he supplied certain people in this country with peptides that were used regularly, even just about before the understanding of what the name and everything was. And they were very effective in supporting health.
Yes,
Hmm.
that's for sure.
Hmm.
Carol, would you like to add something about nutrition that can affect our anti-aging
Oh my
or
goodness.
hormones or
Or
hormones, whatever?
or hormones. Uh, so hormones are so important that you really have to look at all your endocrine systems because we talked about
Mhm.
pituitary hormones like growth hormone, LH, FSH, prolactin. These are hormones that I like to see, and they should be pretty normal, or there's some things you need to do. I wanted to say, like, just the iodine makes a difference on how you metabolize estrogens, and magnesium is a cofactor for progesterone. A friend of mine just wrote a book. I did a book review on magnesium deficiency underlies ALS, Parkinson's, and Alzheimer's, that we're severely magnesium deficient as a culture. And what really triggered me was that magnesium makes you more insulin sensitive. We have such a big problem with insulin resistance, and how that plays into really throwing off the rest of your hormones. I think looking at insulin and glucose first, and looking at diet modifications for what and how you're eating, and get on top of the insulin resistance is so essential. And there are other supplements that help with that, other minerals and things. So it's a critical juncture that we don't pay enough attention to. I've heard numbers from Ben Bickman, who we interviewed once, Why We Get Sick. He's an expert on insulin. He said 88% of the population is insulin resistant. And I think, as we're talking about hormone functions and how our adrenals work and how our thyroid works and how much sex hormones and vitamin D and bile even, I think insulin and glucose trumps the whole thing. You've got to put that at your centerpiece.
You measuring fasting insulin?
Yes.
Yes. Nobody's doing that. People are checking A1C. I literally had a patient just before doing this who is diagnosed as dementia. He's coming to me to see me for peptides and see if we can do stem cells. And I'm looking at his labs. He's already followed by a doctor who's giving him a dementia medication, Western medicine. And he's got leg ulcers. And I'm looking at his labs, and you know what his A1C is?
Oh, probably 7, 8 or something like.
No, 5.9, which is high. His fasting sugar is 113. It's high by our standards. There's no fasting insulin. Guess what? It's type 3 diabetes. He's yeah. So why can't the mainstream doctors figure that out? He's been treated for several years. They're telling him his A1C is high. They have him on nothing. Nothing. And no fasting insulin.
I went to a lecture one time of a vascular surgeon, and he was talking about stasis ulcers.
Yeah.
And when he started giving people with stasis ulcers, men and women, testosterone, they literally resolved. He also, Dr. Lectin, treats diabetes. Dr. Edward Lectin treats diabetes with testosterone injections. And so here you have a patient who has type 3 plus stasis ulcers. You might have within your reach very powerful treatment for both of those.
Testosterone queen, and I didn't think of it. Sorry.
That's why it's so nice to work in a group.
Yes. This is amazing.
It really does. If I'm ill and I say, oh, I'm ill, what do I do? And Carol goes, do this and this and this. I knew all that, but I needed someone to think for me at that point. And that's very nice.
So I thank you very much. We're at 1 hour, and I think everybody has stuff to do. We're going to do this again. I love it. Maybe next time we'll do the chat and get questions in the chat room. So I really love it. Anybody wants to add something before we go?
Thank you very much. It really was fun for us also.
It was a lot of fun.
I'll speak for myself.
Learned a lot.
Yes, me too.
And people need to know they should strive for 100%. None of this, you're getting old and you've got to put up with those.
Oh, no.
Demand 100% of your practitioners, and it requires that the person themselves really take charge of your health, as Corinne and I say every week.
Very
You
well
have
put.
to take care of yourself. The person that loves you the most is yourself, and you have to pay attention to what's going on. And so it's a learning curve. We should be teaching how to run our bodies back in preschool, and everybody
Exactly.
really be well informed about how their body works and what it needs to work. And it's a big piece of missing education right now.
I think they're just news that saying that they're going to teach nutrition in school.
I saw
I hope
that.
so. I didn't see that.
It was medical school. Actually, RFK said you have to have a nutrition.
Elementary school.
You have to have a nutrition course in medical school.
Oh, whoa.
Yeah, or you don't get federal funding. I just heard that.
I was teaching nutrition in elementary school.
Mhm.
So I bought bags and bags and bags of candies. And I put them on the table all in front of me. And the kids came running into the class going, oh, you can hear them moaning, staring at the candy. And I had a trash can on the table. And I'd say, does this help your bones? And I'd pick up the candy and the kids would go, oh, and I go, well then, into the trash can. That was second or third grade. It was very fun.
That's a good visual for them. They will
Yes.
never forget.
Very
Well,
good. So thank you so much for having
set it
us.
up again sometime soon.
Okay,
Thank
great.
you.
Thank you. Thank you so much. Now
Bye.
I don't know
Bye.
how to close this.